Yeah, come in.
Hey mate, I'm Dylan from the ambulance service. Can I please get you to tell me your full name and your date of birth?
Lee Heal, 16th of May 1990.
No worries. And was it you who called us today?
Yes.
What was it for?
I was having an asthma attack.
Okay. Can you tell me a little story of how it came on and between now? What's happened in between, if it's gotten any better or worse?
Yeah, sure. So I was walking my dog.
Yep.
And then I felt it coming on. So I sat down and took my puffer. And I called you because I wasn't sure if it was lasting a bit longer than normal, but
Yep.
then it started to relieve, so feeling pretty good now.
Okay, no worries. And what would you call this asthma attack? The nature, was it a shortness of breath?
Yeah, I was having trouble, felt like I was trouble getting the breath in.
Yep. Okay. And have you had asthma attacks like these in the past?
Yeah.
Okay, so on a scale of 0 to 10, where would you rate this asthma attack compared to the other ones?
Probably about a 5 or a 6.
Yep. And how long has this been going on for?
It went on for about half an hour.
Yeah. And when did it start?
Probably about an hour ago, maybe a bit longer.
And was there anything that you think might have contributed to it? Were you doing anything out of your daily routine?
No, it was probably just increased pollen and everything.
Okay. Is there anything that makes the shortness of breath worse, like sitting forward, laying down?
Not today. Yeah, no, not that I can think of. Nothing made it worse.
Is there anything that makes it better?
Yeah, also when it happened, I sat down and that made it a bit better.
Okay.
And then my puffer.
No worries. And when this happened, was it a constant or did it come and go in waves of shortness of breath?
No, it was pretty constant until I think the puffer must have started to work.
Okay. And did it impact you at all? Did you have to stop what you were doing to sit down?
Yeah, so I was walking the dog and then I stopped and sat down and once I got my breath back then I was able to continue.
Okay, so besides asthma and taking the dog for a walk, is there anything else that you think might have brought this on?
No, it was probably just while I was out.
Okay, and besides your puffer, have you tried any other treatment?
No.
Okay, no worries. So mate, I'd just like to ask you about any medical history you may have. Do you have anything that I should know about?
No, nothing outside of asthma.
Okay, any past surgeries I should know about?
Yeah, I had surgery on my shoulder probably about 6 years ago.
Yep. And any medication you're taking besides the puffer?
No.
No worries. Are you allergic to anything?
No.
And mate, I'm sorry to ask, but do you smoke, drink, take any recreational drugs at all?
I occasionally have a drink on the weekend, but I don't smoke or any other drugs.
Okay. And do you mind just telling me a little about your family history, like the setup, if you're living with your parents at all?
No, so I'm living with my girlfriend,
Yep.
and most of my family's back in WA.
Okay. And just a bit about your social life, what you do outside of work, what you do for work.
So I work at a pool teaching kids swimming.
Yep.
Outside of that, I'll go to the gym occasionally, and I'll go for a couple of runs a week.
Okay, no worries. So mate, besides the asthma, have you been feeling dizzy? Have you had any sweats? Noticed any weight gain, weight loss, any skin changes?
No.
No worries. Have you noticed any chest pain, palpitations, any fainting, any leg pain at all?
No.
No worries. Besides the shortness of breath, have you been coughing up anything? Any blood in your cough?
No.
No worries. Have you noticed any seizures, faints, headaches, visual turns, funny changes, or fainting at all?
No.
No worries. Have you noticed any nausea, vomiting, abdominal pain, indigestion, constipation, diarrhea, and or bleeding when you go to the bathroom?
No.
Okay. And have you noticed that your bone, joints, and muscles, have they been painful or swollen at all?
No.
Have you noticed dry mouth or dry eyes in the morning at all?
No.
No worries. And when you go to the bathroom, is it difficult to pass urine at all?
No.
No worries. Have you noticed any skin, hair, or nail changes?
Not that I've noticed.
Yeah. Any abnormal lumps, bruises, or bleeding?
No.
Okay. And do you mind just telling me a little bit about your mood, appetite, and sleep? Are they all normal, regular?
Yeah, everything's pretty regular.
Okay, no worries. So, with the asthma, I suspect that it's respiratory orientated.
Yes.
I'd like to do a thorough respiratory examination. It just requires you to take off your shirt if you don't mind.
Okay.
And once again, it just requires a bit of physical contact. If you feel uncomfortable at all, just let me know.
Sure.
No worries. No worries. So what I'm going to do is I'm going to get you to place your hands out for me, please.
Sure.
So what I'm looking for is peripheral cyanosis. I'm looking for clubbing, any wasting into you. Mind just flipping your hands over. And I'm just looking for tar staining here. That's fine. And do you mind just placing your hands out like this for me? You're going to have to hold them there for 20 seconds or so.
Okay.
I'm just going to apply a little bit of pressure for 2 seconds. And what I'm looking for is flapping tremor. And while I'm doing that, I'm just going to have a look at your rest rate. Yep, that's fine. And do you mind just placing your hands that way for me, mate? I'm just going to take a pulse.
Okay.
So what I'm looking for is rate, rhythm and strength. Yep, that's all good. And what I'm going to do is I'm going to take your carotid pulse as well.
Sure.
Yep, that's fine. And now what I'm going to do is I'm going to take a detailed look at your face. Now do you mind just pulling down your bottom eyelids and looking at me? So what I'm looking for is conjunctival pallor, and just look at me normally. And what I'm looking for is Horner syndrome, any unequal eyelids or unequal pupils. That looks fine. And I'm going to look at your nose. So what I'm looking for is polyps, enlarged turbinates, or a displaced sputum. And do you mind just placing one of your fingers over one nostril? Yep. And I'm just looking for the airway. And just the other one, please. No worries. Now, if you don't mind, I'm just going to apply a little bit of pressure on your face and just checking your sinuses.
Sure.
Just tell me if they're tender at all.
Okay. No, that's all fine.
That's fine. No worries. And do you mind just poking your tongue out and opening your mouth? So I'm looking for a central cyanosis and furry tongue. And do you still have your tonsils at all?
Yes.
Okay. No worries. And I'm just going to check your trachea. What I'm going to do is I'm going to get 2 fingers and just place them on either side. A little bit of pressure, you might be a little bit uncomfortable.
Okay.
So what I'm checking for is just equal distance between. Yep, that's fine. And I'm just going to test for a trachea tug. So I'm just going to put my fingers here and I want you to take a deep breath in through your mouth. Thank you. Yep, that's fine. And now what I'm going to do is I'm just going to check your lymph nodes. I'm just going to come behind you.
Okay.
Tell me if they're tender at all.
No, they're fine.
Yep. Yep, that's fine. And do you mind just leaning forward for me? So what I'm checking for now is just scars, bruising, symmetrical air entry, any bleeding at all. That looks all fine. So mate, what I'm going to do is I'm just going to place my hands on your shoulders and I want you to take a deep breath in for me. Yep, that looks symmetrical. If you don't mind doing it again, thank you. Yep. And just one more time, please, Lee. That's great. Now what I'm going to do is I'm going to percuss your back, and I'm just trying to hear for a hollow sound. Yep, that's all fine. I'm just going to do it this side as well. Yep, that's fine. And now what I'm going to do is I'm going to also take your chest. So I'm just going to put my stethoscope on you, and when you feel that, I want you to take a deep breath in and a deep breath out for me. Thank you.
Sure.
That all sounds good, Lee. So what I'm going to do is I'm going to do that again, but do you mind just saying 99 every time you feel the stethoscope back on your back?
Sure. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Yep, that sounds all good. Now what I'm going to do is I'm just going to palpitate your back. If there's any tenderness at all, just let me know.
Sure.
Is that feeling alright?
That's all fine.
Yep, it feels all good as well. We'll do it on this side as well, Lee. Yep, that's all fine. So now what I'm going to do is I'm going to do the exact same on your front if you don't mind.
Okay.
So once again, I'm looking for scars, deformities, looking for some symmetry, any use of accessory muscles. There doesn't seem to be any. So what I'm going to do is I'm going to place my hands just here, and I want you to take a deep breath in and a deep breath out for me, please.
Sure.
Yep, that's equal. And just up here. Yep, that's all good. And now what I'm going to do is I'm going to percuss again, so just the little taps again.
Sure.
Yep, that sounds all normal. So now what I'm going to do is I'm going to oscillate again. So once again, when you feel the stethoscope, just take a deep breath in through your mouth and a deep breath out. Thank you.
Sure.
And I'm just going to do that again, but every time you feel the stethoscope, do you mind just saying 99 again?
Sure.
Thank you.
99, 99, 99, 99, 99, 99, 99, 99.
That sounds all good. And one last thing, I'm just going to once again palpitate your chest. If there's any tenderness or uncomfortable, just let me know.
Sure.
That feeling okay?
Yep.
Yep, that feels all good. Nelly, you can put your shirt back on if you don't mind.
Sure.
Okay. So Lee, everything sounded normal, everything sounded good, you sound okay now. Now did you want to come to hospital with us by any chance?
No, I think I'm okay. I was just a bit concerned. I thought it was taking a bit longer than normal.
Okay, no worries. I recommend just seeing your GP after this,
Okay.
just to double check everything.
Sure.
But besides that, thank you for your time, Lee.
Thank you.